Welcome to the Health Channel, All Health All the Time. I'm Olga Villaverdi, coming to you from the Baptist Health South Florida studios in Coral Gables. Preterm labor. That's when a woman's body prepares for birth too early in their pregnancy, and it can lead to an early birth. This can sometimes be alarming for a mother, but the good news is that there are a lot of things doctors can do today to delay a delivery. And of course, the longer your baby gets to grow inside of you, right up to your due date, the less likely he or she is to have problems after birth, which is what we all want. So joining us today to talk about preterm labor and preterm birth is Dr. Alberto Sirven, obstetrician gynecologist at West Kendall Baptist Hospital. Welcome back.
Oh, nice to be back, Olga.
Thanks for being here again, doctor. We really do appreciate your time and all the education that you give us. Let's first talk about preterm labor. What exactly is it, and why does it happen? Because it doesn't happen to all women.
Well, preterm labor is delivered anytime prior to 37 weeks.
37 weeks.
37 weeks. And it happens for multiple reasons. There's a lot of risk factors that I think we're going to discuss today. That we're going to look at some of the things that could be done to prevent preterm labor. Also, patients who have a prior history of preterm labors will benefit from certain medications that will decrease the chance of them having preterm labor next time they get pregnant.
And in that situation, and I'm sure you've seen it happen, Dr. Sirven, where it's occurring and a mom gets very nervous. But, you know, at that moment, they should be calm because we've come a long way. There's a lot of things that can be done, right?
There are multiple things that could be done. There's even some studies now, some tests that are available out there that will let you know if you have risk of preterm labor, even if you've never been pregnant before. So we have gotten a long way. And not only we have gotten a long way from preventive preterm labor, but also we gotten a long way of treating babies who are premature. So I think our advance had both on the spectrum of taking care of the mom, but in a better spectrum of taking care of the babies.
Absolutely. So let's discuss some of those factors that could increase a mother's risk of preterm labor. We have a graphic here. Smoking, that goes without saying.
Well, I think
shouldn't be smoking at all.
Right. I think that really, when we look at these risk factors, these are risk factors that we could modify and change pretty easy. And I think that these are so important to change when you're pregnant. We should not be smoking at all. But when you're pregnant, you definitely should not be smoking. Smoking increases the chances of underweight babies and also preterm labors. Another thing that is either, you know, the big spectrum in life is either not to be overweight or underweight, by that matter. And I think that if you are doing a great control of your diet prior to getting pregnant, and once you're pregnant, you're going to decrease the chances of being in that spectrum in life. And also getting good prenatal care. You know, if you don't follow your doctor's advice, if you don't go to your doctor's office on a regular basis and your prenatal care is not adequate, you have a higher chance of preterm labor. Alcohol, drug use, of course, alcohol has shown to cause alcohol fetal syndrome, which is a reason for multiple fetal anomalies. So alcohol is definitely discouraged during pregnancy. And having health condition, well, any type of chronic medical problem could definitely increase the chance of having preterm labor. I think a lot of those chronic medical problems could be addressed prior to getting pregnant, so you could decrease the chances of getting pregnant. And other risk factors, yes, if you have a baby that has a birth defect in general, there's a higher chance of having preterm labor. As far as in vitro fertilization, of course, every time that we do something that maybe is not as natural and somehow interfere, there is an increased chance, but the majority of the in vitro pregnancies will develop into a full-term pregnancy without any problems. Multiple pregnancy, anything that is greater than one, increase the risk. Nowadays, especially with in vitro pregnancies, we try to decrease the number of zygotes that are implanted. Therefore, you don't want to have 3 or anything greater than that, because definitely increases the chances. If you had a prior history of premature labor, there's definitely increased risk of preterm labor, and those patients should get certain medications that are given to prevent the recurrence of this.
All right, and we also have a graphic of some of the warning signs of premature labor. In case you are currently pregnant right now, you can look out for these. When I was reading them, doctor, I was also aware that these are also very common symptoms of you going into labor as well. But these are some warning signs: backache, contractions, cramping, fluid leaking. You know, I kind of experienced that when I was going into labor and I was full term. So how do you decipher?
There is all those signs that are mentioned in there. increase the chances of preterm labor, but also common signs, as you mentioned earlier, during pregnancy. I think the important thing is, first of all, to discuss it with your physician when you feel this situation and this cramping and this pain, and where in the pregnancy you are. Is it very different from being at past 37 weeks than prior to 37 weeks? So I think the relationship with the physician is one of those things that's going to help you significant to determine whether those are signs, normal signs of pregnancy, or they're associated with preterm labor.
Are there some there that are a bit more serious where you think, okay, this cannot be kind of full-term stuff? I saw, for example, vaginal bleeding. That would be a little bit more of a alarm?
Definitely vaginal bleeding will be associated with higher chances of preterm labor. Leaking fluid is also something that you're very concerned about. Contractions, if they become regular, they're definitely associated with increased chance of preterm labor.
All right, and we're going to talk more about preterm birth a little bit later in the show. But for now, we want to clarify for our viewers that preterm labor doesn't necessarily mean you'll have a preterm birth. Is that correct, doctor?
That is correct. And the idea here is that you prevent from having a preterm birth. You will have a certain amount of preterm labor and there's increased risk of having a premature baby, but not necessarily means that you will have one.
All right, so we mentioned that there are ways to delay, possibly stop, or even slow down labor. So how do we do that?
Well, there are certain medications that we give. In particular, something called magnesium sulfate is one of those medications that we tend to use, not only to prevent the delay preterm labor when that happens, but also to allow us time to mature the baby's lung and get certain medications to the mom that will allow the lungs of the baby to be mature. Because the idea is not only to prevent preterm labor, but if preterm labor cannot be cannot be stopped, you want to have a baby that has a very good chance of success.
Absolutely. Now, I read here that a key way to kind of spot if you're going into early labor is contractions. Right? So how do you know, do you count them? Is there a way, someone once told me you could put your fingers on the abdomen to figure things out in terms of maybe you playing doctor for just a few seconds? Well,
contractions is going to be part of the normal process of labor, and not necessarily they mean that they're going to be preterm labor. I think that the important thing when you are to monitor contractions is finding out whether those contractions are rhythmic, whether they happen at a certain time, and how long do they progress for. I mean, you're going to have contractions through the whole pregnancy, especially when you're dehydrated. If you have some type of medical condition, maybe you have the flu, and you're just not taking a lot of liquid, and that will increase your chance of having contractions. So I think that in general, anytime that you have contraction, the most important thing is for you to monitor and time them and see how often they are. If they are irregular and they're spaced out, that most likely is not an evidence of preterm labor. But
spaced out in terms of like what, every 30 minutes? But if you are getting one maybe every minute?
Well, definitely every minute would not be. If you're getting them every 10 minutes, is already considered.
Okay, every 10 minutes.
But the question is...
It was a long time ago for me.
But the question is, how long do you have them for 10 minutes? Because you could have them for maybe half an hour, and then you never have it again.
Okay.
Or as opposed to if you're having them every 20 minutes, but they're for 4 or 5 hours. So that also makes a huge difference.
So how long it lasts?
Exactly. The interval of time in which you have that and how often are they happening as two things that you can monitor well.
We hear a lot about contractions and Braxton Hicks contractions. What are the difference, doctor?
Well, Braxton Hicks is nothing more than a classification of the contractions that are not necessarily associated with labor. Braxton Hicks are basically those that we describe as earlier or irregular contractions. There's not really any difference per se. It's just a classification of the contraction.
And if there is preterm labor, do you suggest sometimes bed rest for the mom? And in what case would you really suggest it?
I think in general it's being something that we have done over the years, in which we consider that having bed rest definitely helps the mom and decreases the chances of preterm labor. So I think the majority of cases, whenever there's evidence that this is occurring, whether you have regular contractions that you monitor them, you have shortening of the cervix, or certain tests that are done to determine your increased chances of preterm labor, definitely bed rest is one of those things that we recommend on a very common.
You had mentioned at the beginning of the show that 37 weeks is kind of like the magic number that you want to get to.
That's what we want to get to.
All right. If you surpass I'm just curious because I really forgot. It's been a long time. If you surpass that 37 weeks, even though I know we're talking about preterm labor today, it's okay too, right? You could go to 38, even 39?
Well, I mean, the normal pregnancy by last menstrual period is 40 weeks.
40 weeks, okay.
Now, after 39 weeks is what we consider nowadays that the babies are completely mature.
Got
okay,
it.
so we prevent or try to prevent, especially in this health system. I think we started about 4 or 5 years ago with the March of Dying to decrease the chances of neonatal ICU admissions by having babies that were delivered between 37 and 39 weeks, and we were finding out that some of those babies would end up being in a neonatal ICU unit more often. So it's been a movement nationwide to have deliveries done after 39 weeks. And the ideal time is to have a baby delivered after 39 weeks.
Okay.
Now, we don't stop a baby if you have a spontaneous labor after 37 weeks because it's completely normal. We just don't do elective deliveries prior to 39 weeks unless there is a medical indication for it.
All right, and then again, anything before 37 would be considered?
Anything before 37 is considered preterm labor.
Preterm labor. Okay, fantastic. I was trying to get my numbers in order for the future when my kids have babies, which we're so far away from that. Coming up next, what happens if your baby is born early? And have you heard of the term micro-preemie? We're going to talk about the difference between a preemie and a micro-preemie when we return. And stick around because later on this hour, we're going to have a special guest to discuss healthy exercising habits while pregnant. She's just about to have a baby. Wouldn't it be fun if she had it on the air here?
Not today. Not today.
We got a doctor in the house. You're watching the Health Channel. All health, all the time on South Florida PBS. If you have a question for Dr. Sirven, please give us a call using the toll-free number, 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel, submit questions for the experts, and watch videos from previous episodes. We'll be right back.
I may look like all the other dogs, but I was born for a purpose. To one day be your companion, your eyes to see the world. I'll be your courage, your friend. With me, you'll find new freedom and hope for a better future. A dog I'm not. I'm a Southeastern guide dog.
A brain aneurysm doesn't care that you have important meetings. It doesn't care that you have to drop your daughter off at ballet and your son off at soccer practice. So if you suddenly experience the worst headache of your life, sharp pain behind your eye, and blurry vision, seek immediate emergency care. The Lisa Calagrassi Foundation, shedding light on brain aneurysms. Learn more at lisafoundation.org.
Hiney, tushy, badonkadonk, call it what you want, but talk to your doctor because the American Cancer Society says colon cancer is a leading cause of cancer deaths in the U.S. I was diagnosed with colon cancer, but I might have avoided it completely if I just had my keister checked. So get off those juicy doubles and go get your rump shaker screened so you can say you literally saved your own Can we change padonkadonk?
Families come in all sizes and shapes. Sometimes your friends are your family by choice, or sometimes you're just stuck with Uncle Charles. But what we know is that you want to protect the people that are close to you, but the flu can unravel everything. Your flu vaccine protects you and your family. No matter what draws your family together, protect yourself, protect your family. Everyone needs a flu vaccine.
A brain aneurysm can strike you when you least expect it, plunging your entire world into darkness. But if you know the warning signs, you're much more likely to survive. If you suddenly experience the worst headache of your life or sharp, sudden pain behind your eyes, do not ignore it. Please seek immediate emergency attention. It's time to shed some light on brain aneurysms. You gotta know the information.
The Lisa Calagrassi Foundation, lisafoundation.org.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Dr. Alberto Sirven, obstetrician gynecologist at West Kendall Baptist Hospital. If you have a question for Dr. Sirven, please give us a call using the toll-free number right there, 855-796-4475. We would love to hear from you. So here's a statistic. About 1 in 10 babies born in the United States are preemies. Most preemies do well as they get older and catch up to their full-term peers in time, but these babies do have a higher risk of complications. So now we're going to meet Amanda. Amanda grew up in a family of smokers and picked up her first cigarette in 5th grade. Later, when she was in college and she learned she was pregnant, Amanda tried to quit, but her addiction to cigarettes was too strong. Her baby was born 2 months early and weighed 3 pounds. Take a look.
When I found out I was pregnant, I was 24 years old, recently engaged, and a year away from student teaching in college, and still smoking cigarettes. I knew that smoking was bad, well, at any time, definitely, while you're pregnant, but I didn't think it would happen to me. I didn't think I would have a premature baby. I thought everything was going to be fine. It wasn't. I went into an ambulance. I was very scared. I felt alone. I felt like I hurt my baby. When my daughter was born 2 months early, she had to be placed on a feeding tube. I was not able to hold her. After she was about a week old, I was able to do skin-to-skin contact, but that was only for less than an hour a day. The only time I was allowed to touch her in her incubator was every 4 hours for a diaper change.
Very, very powerful story, Dr. Sirven, where she shares and she opens her heart to others to explain how dangerous smoke. I mean, she was placed on a feeding tube.
Well, that just goes to show you those risk factors that we could change.
Yeah.
Are really the most important things that we could all learn from it. There are certain things that we could not change. Some people have medical conditions that increase your chances of preterm deliveries, and those are things that we're probably not able to change. We could help, but not necessarily change them. But when we look at risk factors that are modifiable, such as smoking, alcohol, I think it touches our heart because, you know, not only we're affecting those patients that have the condition, but we are affecting future generations. As you could tell, this patient, not only she suffered from this, but she was a smoker all her life. Her mom was a smoker. And I think that we have to break that chain somewhere in order to make a difference in people's life. So that's why all these programs that talk about education and discuss all these things are so important, because those are things that we could change in society.
And we didn't hear her full story, but I can only imagine that there's the possibility of this baby, Amanda, having long-term health complications due to all of that.
There's definitely a very high possibility of Amanda having multiple medical conditions. And I mean, we talk about some of how that affects society in general. I mean, we have to understand that neonatal intensive care is probably one of the highest costs of, our costs of, as a group here in South Florida. This is a very, very high risk population, and we have issues in which we increase costs of health care. Secondary to that is significant. So when we talk about addressing costs of health care, this is some of the things that we have to change.
Absolutely. And we really want to thank her for her story. Very personal, but creating awareness, so we thank her for that. We have actually a graphic that can show you some of those long-term health complications that preemies can have, and those would be autism, intellectual disabilities, cerebral palsy, lung problems, and then vision and hearing loss. We have the doctor now at our 3D image wall. And doctor, I believe you have the example of cerebral palsy. So can you tell us what we're looking at, please?
Well, what we're looking at here is a diagram of the brain. And here we could see that when there is damage to the white matter and there is damage to the ventricles secondary to ventricular leukoplasia, we're going to have damage to the brain. You have to understand that in general, when we talk about prematurity, one of the parts of the body that is not developed is the brain. The brain and the lungs tend to develop later in life, so the earlier the baby is, the higher the chances of having damage to any part of the brain. This will cause increased chances of autism in general, and in this younger population, there's increased chances of cerebral palsy, as well as lung conditions. We have improved a lot of things in neonatal intensive care units to decrease mortality. But the quality of life, it does get affected significantly to these children, secondary to the conditions that affect mainly the brain and the lungs.
And when these babies, I should say preemies, are affected with these health risks, they are immediately taken normally to the NICU, right, doctor?
Yes, well, these babies are delivered and immediately taken to an NICU unit. Now, these conditions or the damage is not going to be something that we're going to be able to tell right away. And needless to say that there is very small premature babies who do very well, and unfortunately, but the majority of them do tend to have some sequels in long-term life.
And in the NICU, I mean, I've been there before, it's just an army of nurses and doctors doing everything humanly possible to help all these babies. It's amazing to see.
Well, I think that in general, in obstetric, one of the things that we have advanced over the years is the development of the NICU and how well we're able to treat these babies now as opposed to many years ago. And that's one of the big things that we have in this country as opposed to other countries in the developing the world. Even though the obstetrical care might be exactly the same, when you have a high-risk pregnancy, when you have a premature baby, there's no place in the world those babies survive better than the United States.
That's absolutely right. Great stuff there. Okay, thank you, doctor. Now, becoming a parent, we all know can be very scary, but even more nerve-wracking are unforeseen complications. It's important to know that there are options out there to help kind of ease your anxiety if your baby needs to be in the NICU for example, for an extended period of time. So let's take a look at this package and we'll talk about it right after.
So the NICU is a series of pictures or photographs that are sent through a NICU camera. It's on 24 hours a day. It's only turned off when there's a touch time, either the nurse or a physician. Well, from the parent side, it works from either a smartphone, from a computer. It's a web-based application. They go in. Obviously, there's a password, so it's password protected. So they can see their child from anywhere around the world.
Before the camera, I used to call all the time just to see what was going on. And like, I know that if I log on and it says the nurse is caring for your child, he's getting his touch time. So I get less anxious even if I just see him for 2 seconds.
Yeah, I think it's also saved our nurses that we're not calling them every 30 minutes. But it really does make a difference. You know, speaking to someone on the phone is always great, but just pull out your phone and take a look at them and it makes all the difference.
So this has all been supported by philanthropy. So through the Foundation of Baptist Health of South Florida, we were able not only to supply 1 camera, but we were able to actually purchase 62 cameras. So every baby in our intensive care unit has its own camera.
He's falling asleep finally.
Yep, it's our little guy.
Oh my goodness. Not even my baby, and it's so heartwarming to see that.
It is.
Oh my gosh, I kind of even teared up there. It's just amazing that these people are donating, their money to help families be able to stay in contact with their babies, because you can't be there 24/7, which they would like to be there, of course.
Of course, and I think that this is one of the things that the foundation has done a great job.
Absolutely.
About this health to provide this to the parents, because there's nothing more nerve-wracking than having a baby in that unit and don't knowing exactly what's going on. So the ability to see that baby the majority of the time is a new program, is excellent. I think it provides a safeguard to a peace of mind to those parents, because you have to understand that the mom is going to deliver and she's going to go home, and the baby is going to stay here, and it's going to stay for a long time, sometimes for months. So the ability to be able to access that child immediately on that is incredible. Technology is just amazing nowadays.
You must have so many patients where you've had to calm them down a little bit too, because emotionally it can't be easy for a mother. I mean, you'd have to really talk to me, doctor. a lot.
I think that in general, when you have a patient in a unit that is increased risk of preterm labor, I think that you have to understand what the condition that the patient has, and you have to understand the relationship that that patient has to trust that all the decisions that are made are to the benefits. I've had patients in the unit that sometimes stays for months.
Wow.
So I always come in and tell me a joke. I mean, the unit here is here next to the US 1, and of course it has no ocean view, but I always tell them, look at the ocean view that you have since you're gonna be here for a while. So it's a matter to just, smooth things, make them feel happy, make them understand that even though it's uncomfortable being in a small room, is really the best for the baby. The majority of them understand it. Sometimes, especially if their water breaks or something happens and they are gonna be confined to that place for a very, very long time, they have people who come and give them therapy, like they do some type of painting and certain things. Their family provides a lot of support.
Right.
I think it's so important because you have to understand that the longer that baby stays inside the mom, the less of a bad baby having to be in an ICU, and therefore the higher the chances of baby doing well afterwards.
And it speaks volumes of the nurse. All nurses are fantastic, but it speaks volumes to the nurses there in the NICU and what they do to care for these babies 24/7.
I think that the nursing staff at every hospital is very, very important, but I think that maybe I'm a little biased, but I think that obstetrical nurses as well, neonatal ICU nurses, do an excellent job.
I think so too.
Because they spend most of the time with those patients, and they are there for them, and they really understand them. They create a bond. They create a relationship with those patients who, over the years, just carries on. I mean, they have a program here at South Miami Hospital in which those neonatal babies get once a year. They get together, and you can see the growth of those babies, how they're doing, how well they're doing, and it's excellent.
Fantastic.
It really is excellent.
And the moms come back too?
Their moms come back too.
Oh,
so
that's
it's
so
a great
nice.
experience for everyone.
Oh, that's
Because
great.
it becomes a family.
Absolutely. I mean, if you think about it, if a nurse is taking care of a little baby for 6 weeks, 7 weeks, 8 weeks,
Yeah, it becomes part of your family.
Absolutely. All right, great stuff, doctor. Thank you so much. Well, coming up, did you know that certain exercises can actually help move the baby into position for birth? And what exercises should you try? And which exercises should you avoid while pregnant? And wait till you hear what I did at 38 weeks. The doctor's gonna be like, I can't believe you, Olguita. I can't believe this. And then we have a special guest, Janette. Janero, I think it's, or Janette Janero, I'll get it right. She is a fitness expert and owner of the Naked Formula in Miami. She's 37 weeks pregnant. Stick around. She's going to be with us in just a couple minutes. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for the expert, please call us using the toll-free number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel, submit questions for the experts, and watch videos from previous episodes. We'll be right back.
Keeping your kids healthy is the first step to protecting their dreams. When you keep them safe, there's no limit to how far they can go. Nothing is out of reach. No mission? Impossible. Give your son or daughter a better chance to see their dreams come true. Give them the HPV vaccine at age 11 or 12 to prevent HPV cancers later in life.
When you lose hope, I'll be there. When your world goes dark, I'll lead the way. When you come back home, I'll be by your side. I'll give you hope. I'll give you confidence. I'll be your freedom. I know I'm little now, but when I grow up, I'll be your Southeastern guide dog.
Hi, this is Terry Bradshaw here to remind you that rheumatic diseases like rheumatoid arthritis and lupus are important to know about. If you're like me, you don't have time for flare-ups to slow you down. That's why I've taken the American College of Rheumatology's pledge to live well with rheumatic disease, and you should too. Things like eating healthy, staying active, not smoking, and managing my stress keep me going. Visit simpletask.org to take the pledge to live well.
Good night, stars. Good night, air. Good night, noises everywhere. Time to say good night.
Cancer doesn't run in my family. That really was the farthest thing from my mind. I've been an athlete my whole life, and I work in sports, so my mindset was just, let's fight. So our stories are all unique, so whatever you're going through, ask questions, get information, and be involved. Don't ignore the signs. Join the fight. I'm Tony Beasley, and I'm a stage 2 colorectal cancer survivor.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Dr. Alberto Sirven, OBGYN at West Kendall Baptist Hospital. If you have a question for the doctor, please call us using the toll-free number, 855-796-4475. Also joining us today is a very special guest, Janette Janero. She is a fitness expert providing in-home personal training, remote health coaching nationwide, the owner of the Naked Formula. I like the name. Naked Formula. We'll talk about that. And is currently 37 weeks pregnant with her second child. You look fantastic.
Thank you. I feel pretty good.
You feel good?
Yep.
All right. So first tell me, is it a boy or girl?
It's a boy.
And your first one is a
boy.
All right. So with your first pregnancy, how far did you take the pregnancy to? How many weeks?
37 weeks and about 3 or 4 days.
Oh, okay. So you made it to, a good amount of time. And you are 37 weeks today?
Yes. We could have a very exciting second half of the show.
I know. Wouldn't that be great, doctor? I mean, come on.
That would be interesting.
We'd be like, she's down here. We're doing good. Breathe. I'd be coaching her. Oh, that would be fantastic. Okay. So has the second pregnancy been a little bit better or worse than the first in terms of carrying the baby so far?
It's been pretty much the same.
Yeah?
I don't know if there's any truth to carrying boys and girls differently, but I feel like I'm carrying my second pregnancy pretty much the same as my first.
Have you ever heard of that myth?
Well, I think every pregnancy might be a little different, but overall, one of the things she does is she's in great shape.
She's in great shape,
so
yes.
that makes a huge difference, and I think that you could see that majority of patients who are healthy and in good shape are going to carry the pregnancy well.
And we're going to talk about exercise in just a second, but I have a question. Any contractions lately or nothing?
A couple Braxton Hicks here and there.
Yeah. But you're pretty cool about it.
Yeah.
Pretty calm.
I know what to expect now.
All right. Yes. After the first one, you kind of know what to expect with the second one. All right. So let's switch gears and talk about overall health pregnancy. You've always been an exercise, guru, right?
Yes. I've always loved exercise.
So you continue to exercise even when you found out you were pregnant. So tell us about how when you got the news, did you just go on with the exercise? And what did you incorporate?
So the first pregnancy, when I got the news, my husband and I, we had been wanting to get pregnant for a while.
And there you are.
Yes. And I thought to myself, oh my goodness, I was a little bit scared. But I kept on with light. No, I didn't feel comfortable running. I kept on with light resistance training.
Okay.
And when I hit about 6 weeks, that's when the nausea started. And just the thought of standing up and walking around, in the gym was too much. So I took my workouts, if you will, outside. So I would do brisk walks.
So you modified?
Yeah. And
based upon how you were feeling? Okay. I know you know a lot about exercise because I read here that you have a master's in exercise science. First of all, what got you interested in all the health and getting the master's?
So I started teaching group exercise as a way to, make money doing something I enjoyed. But that led to the opportunity to become a personal trainer, and it opened up my eyes to a career where I felt 100% at home. I am able to, meet people from all walks of life and also help them on their journey to become their healthiest version of themselves inside and out. So then I decided to pursue a master's degree to just elevate the level of service I can offer my clients.
And I love in those pictures, doctor, did you see her with the weights and staying in shape? What's the conversation you have with moms to be about that exercise while you're pregnant?
Well, I definitely encourage the patients to exercise. I mean, one thing great about her is that she was exercising prior to pregnancy. It's so important for patients to maintain that. But even those patients who do never exercise prior to pregnancy, I encourage them to especially do, if you never exercised before, you do walking. Another thing that I encourage significant here in South Florida is swimming, because swimming you could do through the whole pregnancy, and we have so many pools, and the ability is, and I tell them it's not a matter of just laying in the pool. Just do exercise, time yourself, swim a couple of laps, do something that makes a difference so you increase your heart rate, help your cardiovascular system significantly. So overall, I mean, it was great the fact that she was exercising prior to it and she kept it up. There's a lot of patients who once they get pregnant, they feel that they no longer should exercise, and I think that's just so wrong.
So let's take a look at some exercising rules for each trimester. This is what I think you followed. The first trimester, you suggest walking?
Correct. So I personally, based on my experience, walking worked out great for me. There's some women who don't experience morning sickness. They may be able to continue exercising as they normally did. But walking for me, it felt great to get out there, get some fresh air. And in the second trimester, I like to avoid jumping. We're going to get into that a little bit later, and hyperextending and twisting type of motion. Also, as the belly starts getting bigger in the second trimester, it's a good idea to avoid exercises where you're lying on your back, as that can restrict blood flow. And then the third trimester, flexibility is my main goal.
Okay. Now, I've heard, doctor, and you could correct me if I'm wrong, but if you were a runner before pregnancy, an avid runner, you can run during pregnancy too. And that's what I did.
You can run during pregnancy, but I think once you get to second, third trimester, you're probably going to feel a lot more uncomfortable. And also there is a chance of, it depends what medical condition you could have.
Exactly.
If you have a low placenta or certain conditions that increase the chance of preterm, some of those exercises should be definitely decreased.
Okay, and what are some do-nots that one should not do when they're pregnant, doctor?
Well, I think one of the things that you described earlier, especially on your back, you're going to decrease your return of blood flow to your heart and therefore decrease the perfusion to the uterus. So those are one of the things that you try to avoid significantly during pregnancy.
Fantastic. We have some pictures of you doing your thing, which I love because I was such an avid exercise guru too. What are you doing here?
So I'm using a resistance band. The reason why I'm using this, it's a very lightweight piece of equipment. You could store it underneath your couch and you don't have to worry about, dropping it on your toes or, it's really safe equipment for pregnancy. What I'm doing is a kickback exercise, and this will help strengthen the glutes. Strong glutes lead to stable hips. And hips are, the name of the game with pregnancy, trying to get the baby in the right position. So that's an exercise that I'm doing here. If you look at the next picture, what you're doing is you're bringing your leg forward and then kicking it back with the resistance band.
And that helps in terms of just staying in shape and keeping those muscles moving?
Yes.
And nothing really to hurt the baby or you for that matter.
Exactly. Now right here, what we're doing is a row type of exercise. If you see in the next picture, you just pull your elbows back. This is important because as your belly starts to grow, you must keep that posture. You want to keep those shoulders rolled back and pressed down. And this exercise helps strengthen the rhomboids that help get you into that perfect position.
And I think we have some more pictures that we can maybe follow up with. Do we have those if we can take them? I think there's one on her side. Let's see if we have that. There we go. Thank you so much.
I absolutely love this exercise. You tie the resistance band around your calves and then you lift your knee up. This is a clamshell exercise. This is great also for the glutes. It helps strengthen the glutes. It's a different area of the glute that you're working out. And then also as you're doing this, you can strengthen the pelvic floor by tightening those muscles as well.
That's fantastic. And something I wanted to talk about, doctor, is when I see her doing this exercise, and a lot of my friends did too, and I did too, you hear that old adage, I'm eating for two, which I don't think that's true. I think you can just eat your normal routine, but you're also preventing from getting more weight gain too while you're doing exercise.
Well, I think that two important things. First of all, I think I mentioned this in the show earlier, not in this program, but in another program. That is the biggest misconception, that people think that they're eating for two. you're eating for one, and a healthy person is what you're eating for. And I think it's so important, the fact that also exercises that she's showing, not only strengthen your muscles, but it helps you so much to have a vaginal delivery. I mean, I think the better that your musculature is, the more toned you are, the higher your chances of having a vaginal delivery. I mean, there's conditions why you will need a C-section, but the majority of patients who keep an adequate weight, exercise, and have a good support of their muscle structure are going to have a vaginal delivery.
That's right. And then also we talk about not wanting to gain that weight. I mean, I don't know how many pounds you gained. You looked like very little. How many have you gained since?
The first pregnancy, I gained 32 pounds, and so far with this pregnancy, 35 pounds.
That's fantastic, you know? So I think, you know, I don't want to play doctor here, but she's going to get back into shape even faster after she has the baby.
Without a doubt. I mean, without a doubt, she's going to be back in shape right away. Well, she's in shape now. She's
right, exactly.
But that does not mean by any chance that she's not in shape. And when she finishes it, the pregnancy, she's going to go back to her normal weight right away. But I think it's so important. I mean, what you're doing, I think, is great. And I think that it would be great to have more of those programs out there, and to have trainers that go out and teach people the right exercises, strengthen your pelvic muscles. That's such a great exercise, not only for pregnant patients, for a majority of women. It's not sometimes it's so important. People talk about exercising. I think you should have an expert do your exercise.
Absolutely.
And teach you how to do it.
And the benefits of exercise go way beyond what you see in the mirror or on the scale. It's just about how you function as a person throughout life.
And I'm sure you take a lot of pride in helping moms-to-be who maybe have never exercised, or are frightened of exercise, or maybe they don't know how to do it. It's great to have someone that can guide you so you don't have that hesitation, right? Because a lot of moms get worried. You know, I don't want to lose the baby. I don't want something to happen. And then you have someone like her who could say, don't worry about it. We'll modify exercise for you. You could do that, right?
Yes, and even afterwards, there have been many times that I've been carrying a baby as the mom is working out in her living room. You know, so I'm trainer / babysitter at that time.
That's
so
good.
It's really fun. It's a really great service to offer.
Doctor, what do you recommend in terms of working out throughout the week? You know, a couple days a week, a few days a week, or just whatever your body wants to do?
No, well, I think that if you had an exercise routine, you should keep it. And if you never had an exercise routine, I think doing some type of exercises at least 3 times a week would be ideal while you're pregnant. But that's the least that you could do, to at least maintain a certain amount of weight. But I think it's so important that you look for professional people who know what they're doing, because you don't want to hurt certain muscles, you don't want to hurt certain parts of your body. I mean, certain things like walking and all those things you could definitely do. But if you're going to get in a routine exercise, I think it's ideal to have an expert to help you out.
Yeah, so you were mentioning swimming, and one of the reasons why that it's such a great exercise for women who are expecting, the act of being in the water just helps relieve some pressure from your belly.
True.
Plus, as you're kicking, your hips are rocking back and forth, and that's helping loosen up the tendons, and that helps the baby get into the right position. Same thing with walking. If you're walking or you're sitting and you're slouched, gravity is going to turn the baby in the position where it's not ideal. But if you're sitting up, ideally, a good rule of thumb is letting your navel point downward, shoulders up. That will help also as you're walking, your hips are rocking in the right position. It's loose and free, and the baby can fall into place.
And we're going to talk about more of that in our next segment. Are you just, ready to go and just ready to have the baby?
I can't wait. I'm looking forward to it.
I was at 37 weeks saying, please.
Like I made it to the safe, you know, on term, I'm ready to go.
Absolutely. Well, you know, there is a horizontal exercise that helps expedite delivery.
Yes.
Well,
Doctor, would you like to inform us of what it is?
Well, it's a release of prostaglandin that definitely increases your chances of delivery.
Right. In other words,
intercourse. Okay.
There you go. That's the word I was looking for, but I'm not the doctor, so I thought you'd say it for me. It works. Trust me. And on that note, exercising in your 3rd trimester of a pregnancy is a whole different ballgame than the 1st and 2nd trimester. We're going to talk about why and when we return, and actually which exercises actually help move the baby into position for labor, which is what we talked about for just a few seconds. What's coming up? You're watching the Health Channel. All health, all the time, and some laughter in between on South Florida PBS. If you have a question for the doctor or for Janette, please call us using the toll-free number, 855-796-4475. Also visit our website, allhealthtv.com. We'll be right back.
At Children's Cancer Research Fund, we believe a world without childhood cancer is possible, but it takes all of us. And whether it's developing a groundbreaking treatment or helping a girl realize her dream, everyone has a role in a child's cancer journey.
People ask me how I keep a smile on my face. It's easy when you have so many great people that take care of you and support you.
To find out how you can be a part of a child's cancer journey and a part of the cure, visit childrenscancer.org, a public service message from Children's Cancer Research Fund.
Ovarian cancer is devastating and difficult to diagnose. It's often only caught in advanced stages, and 4 out of 5 women will see the deadly disease return.
I knew when ovarian cancer recurs,
it's often incurable.
It was terrifying, waiting for the other shoe to drop.
Until recently, following chemotherapy, women with recurrent ovarian cancer had to simply watch and wait for their disease to come back.
Well, we say,
not on my watch.
Not on my watch.
Not on my watch. Now, with maintenance therapies, women can extend their time in response and delay recurrence.
Knowledge and awareness of your choices empowers you
and gives you a greater sense of control.
Let's call for a change in ovarian cancer care.
The Not On My Watch movement empowers women facing recurrent ovarian cancer to take an informed and active role in managing their disease. Visit notonmywatch.com to learn more.
Cancer. We don't want to think about it, but I had to. Because you see, I was traveling, I was enjoying life, I was working. It was too long since my last PAP. When I was finally tested, we thought I might have cervical cancer. After worrying, no cancer. I was lucky. Women, please get a Pap test to check for cervical cancer and get the inside knowledge about gynecologic cancers for you and the people who care about you.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Dr. Alberto Sirven, OBGYN at West Kendall Baptist Hospital. Also joining us today is Janette Janero. She's a fitness expert and is currently 37 weeks pregnant with her second child. If you have a question for any of our guests, please call us using the toll-free numbers. That's 855-796-4475. So we've covered a lot of info this hour. We've covered preterm labor, preterm birth, healthy exercising habits to have while pregnant. So let's continue with that conversation, because I want to get now to the third trimester. That's when it kind of gets a little uncomfortable. You're kind of getting anxious and you're less motivated because, well, we know. I mean, don't you feel that right now? A little bit of discomfort and
yes.
Sleeping, what direction?
Yes, like I feel like my mobility is, hindered because I feel like there's not much room left.
But do you still try to exercise?
Certainly. Throughout all of pregnancy, I feel like the main goal for your exercise routine should be promoting circulation and maintaining flexibility.
Okay.
So right now, flexibility is what I'm focusing on, making sure that my quadriceps don't feel tight, making sure that the ligaments around my pelvis aren't getting tight. So walking and stretching is the main thing that I'm doing right now.
And how does that help in terms of, because I ran a lot, but how does that help in then getting ready for that delivery and making it easier not only on mom, but on baby too, doctor?
Well, I think that the fact that those muscles are strengthened, the strength of those muscles has gotten better through the pregnancy, and the stretching allow those ligaments to expand and not to contract will definitely help significantly. Remember that in the liver itself, is you have to have those muscles that relax secondary to certain physiological effects that happens, and allows for the vagina to dilate, to the cervix to dilate, the uterus contract, and all those are muscles. And even though some of those are inside muscles, like the muscles of the uterus, the ones in the vagina are going to significantly be helped by having strength of your legs, your buttocks, more tightening, without having to have a contract muscle that it would not allow to it. I mean, one of the big things that epidural does for people is allow you to relax. When you are able to have these exercises, you are able to relax those muscles, and that allows you to a faster labor. When we discussed earlier how fast she delivered, I mean, she's a primate, she delivered within 7 hours. It's just amazing.
We just found that out.
So it just lets you know that she was in great shape.
That's fantastic. Now, go ahead.
So our body helps us out. You know, the ovaries and the placenta, they release a hormone called relaxin, and that helps relax the ligaments around the pelvis. However, that's the same reason why I mentioned that those twisting and pivoting and exercises that put strain on your joints is dangerous, because it not only relaxes those ligaments, but it can also loosen up the your other joints. So that's why you have to be careful with those sharp, jolty type of movements.
I know you stress a lot of flexibility. We talked a little bit about swimming, which is a great sport. Yoga is good too, right? Do you do yoga with your clients?
Yes, yoga is so important during this time. You are challenging your body, it's challenging your mind, because you know people think yoga is easy, but it gets a little bit challenging holding those movements, and it also helps you get into that state of mind that you're going to be in when you're in labor and delivery. Another exercise that I'm a huge fan of, especially during this time for women, is belly dancing.
Oh, well, look at that. Belly dancing.
So, you know.
That's fun.
Great.
Yeah.
Keeping, a lot of people believe that belly dancing started by women in the past who would surround the mother who was in the labor process, and they would do some movements for the mother to mimic. So I'm not talking about, you know, shimmies and going across, you know, a dance studio, but stationary movements like the hip circles, figure eights, helps tone those muscles, helps loosen those muscles, and it's fun.
That's right. It's a lot of fun. So is Naked Formula. I like the name. So let's talk about Naked Formula. We've got a few minutes left on the show.
So Naked Formula is all about stripping your lifestyle.
Oh, okay.
There are a lot of factors to fitness. There's a lot of factors to overall wellness, and I promote people to look at every single one of these essential life areas to have improvement, and each one affects the other one. So if your goal is getting in shape, well, how on earth do my finances come into play with that? Well, take a look at your budget. You're going to be surprised how much you're spending on, you know, fast food, and you see, wow, I thought I didn't have a budget for healthy eating, but if I cut these bad habits out, then I will. You look at your spiritual wellness. Well, how does that help with weight gain or weight loss? Well, if you think about, you know, living in the moment, that will help you just slow down. It'll slow down your breathing. It'll even help you slow down how fast you're eating. And all of these are examples of habits in other areas of your life that can lead to a healthy weight.
You're very soothing. I could have used you when I was getting, you know, that point of delivery that I was so nervous. Isn't she soothing?
She's great.
She's fantastic. You really are. Doctor, any final thoughts on, you know, women today? You know, we talk about exercise and the importance of it. We talk about the not smoking and the importance of not doing it when you're pregnant, but it's just so much more prevalent when you're expecting, right?
Well, yeah, I think that one of the things that we definitely discussed in today's topic is the things that you could prevent and you could do to prevent preterm labor. And I think that we went ahead and discussed smoking, alcohol, and of course exercises. Those are three big things that if you could change, we would decrease the chance of preterm labor. And then finalizing everything else, important to follow up with the doctors, because there's tests and there's things that we could do to help that baby stay a little longer inside, to decrease the chances of being in an enteral ICU for too long, and decrease the causes of cerebral palsy, autism, and all those things and lung problems that are associated with preterm birth.
And Janette, I have to tell you, even I'm noticing how she's sitting here with this posture. I mean, she's 37 weeks pregnant, and I was going like this, and all of a sudden I went like that, because your posture is just fantastic, which is so important too.
Correct.
That is important when you're carrying, with the balance as well.
Correct. As I mentioned, if you are, you know, the heaviest part of the baby is going to be his spine. So right now I'm sitting in a way where my shoulders are rolled back deep down and my navel is facing towards the floor. So that's allowing the baby's spine to face towards my belly. Now, if I'm constantly sitting like this, reclined on a couch, then what happens is the baby can turn.
Right.
And then that's not the ideal position. And then plus the hips and everything are getting tight. So, you know, it's always important to have good posture, but now you have to have good posture for two.
That's right. So is the older one happy that
yes,
the baby's coming?
He is 2 years and 2 months.
All right. What's his name?
Antonio.
Antonio. And what's this baby's name going to be?
Thomas.
Thomas. Love it. All right. So call the day. What do you think? When you're going to go into labor?
I'm thinking next week, Wednesday.
Wednesday. All right, that's a good time. I hope it's a smooth delivery.
Thank you.
And God bless you. Thank you so much for coming in.
My pleasure.
I hope you have a very healthy baby.
Thank you
know
very
you're doing
much.
everything else.
Thank you.
Doctor, gracias.
My pleasure.
As always, great having you. What fun. Are you going for number 3 just in case?
Perhaps.
Looking for the girl?
Maybe.
People used to ask me that. I have 2 girls. Are you looking for the boy? And I was like, no, I'm too old. That's what I would say. You're not. You have plenty of time. You're watching the Health Channel. Good luck to you. All health, all the time on South Florida PBS. If you have a question, no, not a question. We don't want any questions now. We just want you to go to our website, allhealthtv.com. Be sure to check out that website, allhealthtv.com. You can watch a live stream of the Health Channel. You can submit questions for the experts, and you can watch previous episodes. I'm Olga Villaverde. You have a fabulous day. Take care.